Lawrence Memorial Hospital now brings you better health.
It's called angiogenesis, and basically that means the development of new blood vessels. In our bodies, everybody's, if there's an area of tissue that needs more oxygen, over time the body will grow new blood vessels to that area. The problem is that time frame, and can the tissue survive until new blood vessels go there? When you, for example, have an injury that gets surgically repaired, that area gets new blood vessels grown into it after the surgery, but the tissue's healthy, it has been radiated, and that happens. If you look at somebody who has coronary artery disease, they have narrowing of the arteries in their heart. Over time, they get collateral blood flow to those areas where the arteries have started to block off. And that's fine if the arteries are blocking off slowly, but if they block off acutely, you don't have enough time to grow new blood vessels. It's a time factor. So when we put somebody in hyperbaric oxygen, 100% oxygen at 2 atmospheres of pressure, they're at twice the atmospheric pressure normal, so a significantly higher percentage of oxygen dissolves in their tissues, not just their red blood cells, but their tissues. So if you had an area that was ischemic from a radiation injury, or you've got poor blood flow to your legs or whatever, that tissue gets nourished with oxygen. When that happens, it stimulates angiogenesis. Your body says, hey, I need to grow some blood vessels into that area. And so slowly but surely, new blood vessels get sprouted into that ischemic area. And that's what happens with soft tissue radiation. And it's not like you have normal blood flow when we're done with you. You don't have normal blood flow. You just have better blood flow that can sustain a surgical injury. For example, if you need to have a surgery, it can now sustain healing where it couldn't before. Or you have a wound to heal, and before the oxygen down there was so poor, you couldn't heal it, but now you can.